I'm Seth Mulli. In this episode of The Wellness Effect, we continue our focus on staff wellness. We're joined by human resource expert Karlien Kruger as we explore the topic. I'm really excited to discuss this topic with you because HR is an important function in a business, and I feel sometimes it's often overlooked. How do you see the HR role as an important element of the business?
Yes, Seth, I think HR is largely misunderstood, to be honest with you.
Yeah.
HR is a balancing factor in an organization. An HR practitioner should be there for the people, but also support business, understand business, and add value to business. So I think it's a dual role.
I like that you mentioned that it's a dual role. It's almost adding value to the business, as you mentioned, but adding value to the employee. How do you strike the balance to ensure that you cater to the needs of the business, but also advocate for the needs of the employees?
This is not an easy task. And often I think employees feel that HR stands with management, and management feels that HR stands with the employees.
Yeah.
Because it is a balancing act, and if you think about people in an organization and the value that they add, because without people you can do nothing.
Absolutely.
I'm just thinking of engineering projects and things like that. Without skilled people, you can do nothing. Not nothing, but you can't really operate without people.
Yeah.
And your productivity and your performance of people is so essential. Therefore, HR is the entity that will always listen. In my view, you have to be there for employees. It's become a very, very difficult environment, especially in corporates, for people to operate because they are working remotely, they are working in offices, they need to communicate well. Organizations must communicate well with employees.
Yeah.
Otherwise, they become disengaged. So that's how I see it, Seth.
So in the organization that I'm a part of, our organization specifically calls our HR teams HR business partners instead of like HR administrators. And I think for me, it changes the nature of how we see them. They form part of our Exco teams and Manco teams. So how can employers see HR professionals as business partners and not necessarily as an administrative service?
So for me, it's that we as HR practitioners must know business. So when you go into an organization as an HR person, your first port of call is to understand that business.
Absolutely.
You must understand the value that people are supposed to be adding to the business and how it's actually going to make the organization more profitable. If you don't understand those connections, then you are not at a business partner level. It's not to say that you can't grow yourself to that. You can, but you've got to start getting insight. You have to look at the financials, you have to understand the financials, and you have to understand the HR team's contribution towards that.
I really like that you mentioned that it's a holistic view rather than just focusing primarily on the HR function. Professionals can then be able to add value to the business by having a holistic view.
Yes, no, definitely. I think it's been a challenge for HR for many, many years, is to actually get to that business partner level.
Sure.
And I think great strides have been made in the last 10 years or so.
Sure.
Where people have started to understand that we have to add value to the business, and then to connect the people aspect with the business aspect.
I love that. And how can employers encourage employees to be on a medical aid?
So there's many things that medical aids bring to an organization, especially now with people working remote and so on.
Yeah.
There's mental health issues and so on. But medical aids primarily play a huge role in educating people about physical health, about mental health.
Absolutely.
And that to me is the primary thing, and it supports productivity and
Yes.
performance as well. So you know, there are massive health issues that impact productivity and performance, and those things need to be addressed. If you provide that option for your staff, then you give them access to it.
I like that.
And then they get that education from the medical aids, which to me is an important factor.
Yeah, you've mentioned the benefits of medical aid and mental health, productivity, but what are the risks when staff are not on medical aids for employers?
Yeah, so the risks are that people become ill.
Yes.
You know, there's a lot of organizations, especially big corporates that are working in open plans, disease that can impact productivity. So that's one of the big risks.
Yes.
So when your people are off sick, then you have huge absenteeism issues, and you can then not execute on your goals and your strategies.
No, I like that. It's essential for employers to maybe talk through the benefits of medical aid and how when staff are not on medical aid, it actually impacts not just the individual, but the organization as a whole. And speaking of wellness programs, can employers implement their own programs?
So here is my take on it,
Yes.
is that medical aids play a huge role in the implementation of employee wellness programs. They are the partner of business in employee wellness.
Absolutely.
Because of the educational role that they have.
Yes.
It's a massive impact that they have there. So in that aspect of employee wellness programs, medical aids actually take the hand of business and say, let's ensure that your people have access to healthcare. And for me, that's very important.
Absolutely. And we were chatting about COVID-19 and how I felt that it accelerated employee wellness. What's your take on the role of COVID-19 in highlighting the role of employee wellness and mental health?
So I think, you know, we've always been talking about this fact that we should be encouraging work-life balance. And then COVID hit us.
Yeah.
And then we were sort of forced to really make it a reality now.
Correct.
But, you know, as in anything, it can swing to the opposite. Because now, there can be negative aspects surrounding it. So what I think research has shown is that working remotely is not always the best for mental health. And, you know, it's challenged us to manage performance and measure productivity in many different ways. So I think COVID has forced us to look at a work day in a different way.
Absolutely.
You know, and to not be so inflexible in terms of how do we actually measure performance.
Yes, yes.
Because if you measure performance only on input, which was traditionally the case, then you miss what is actually important, and that's the output. It's challenged HR practitioners and business to actually look at this aspect. Because what one person can do in an hour and someone else might take 3 hours does not measure the actual output that was given.
Absolutely. You're right. COVID actually helped us see that managing people is going to be completely different, and it's more around outputs than inputs. Let's talk about the role of HR professionals. And you mentioned like the perception of the HR field previously was maybe kind of looked down upon, but over time, how has that perception changed to it becoming this professional practice?
It's changed over time in that, as I previously stated to you, we've become more knowledgeable about business and about the impact of people on business.
Absolutely.
it has registered itself as a professional vocation.
Yes.
Which we didn't have previously in South Africa. It was in South Africa, but it wasn't that highly focused on.
Yeah.
Now there's a lot of focus on that as well. And I think just, in general, if I look 30 years ago, there perhaps wasn't as many HR educational degrees
Yeah,
and
you're right.
things like that,
Yeah.
that people could follow. And there's so many different specialization areas
Yes.
in HR.
Yeah.
For instance, I was very lucky
Yeah.
that I had a lot of experience in different competence areas in HR. And it made me a hands-on as well as a strategic business partner. So for me, that is at the core of being a good HR practitioner.
That's good.
Is understanding the operational requirements, but then translating that into strategic objectives and goals.
I love that. I love that. I love that you've mentioned that there's been this evolution of the HR function, that it's now a strategic function. You've been in the industry for over 30 years. What advice would you give to HR professionals, HR business partners around ensuring that their organizations take care of wellness?
I think for me, the most important aspect is that we must, as HR business partners, be able to tell our management teams, our executives, what the risks are, as you pointed out, what the risks are of not having an employee wellness program. We should inform them of what the positives are, how it's going to enhance productivity, how it's going to help with people's performance, how it's going to reduce absenteeism, and all those things that we as HR practitioners together with management often struggle to manage. It also, for me, the thing that the business partners, HR business partners must do is they must actually encourage the work-life balance issue.
Yes, absolutely.
And it takes a lot because it's a mental change that we have to make in the way that we view people.
Yeah, it's an adjustment.
And how we manage people. And that adjustment, I think, is key.
Thank you, Karlien, for your insights. And thank you, our viewers, for joining us once again. Remember to subscribe to our YouTube channel for more information on all wellness-related matters. Till next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.